Hi, I'm John Schuller. I'm a podiatrist at Aurora Advanced Healthcare in southeastern Wisconsin. One of my main professional interests is lower extremity biomechanics. Biomechanics is the study of the mechanics of the living body, how it physically functions. In my case, how the lower extremity, or the lower half of the body from the lower spine down, functions as a whole to both support the body and to move the body forward. My particular interest is the special and intricate role that the foot plays in all of that. The general way that lower extremity biomechanics works is that muscles, tendons, ligaments, and other soft tissues move the bones and hold them together, while the bones bear the actual load or weight of the body. How all of the soft tissues and bones of the lower extremity interact and work together is a very intricate dance. Because of that, it can be easily thrown off kilter. When that complex interaction is disturbed, the structure, motion, and timing of every segment is changed. That's what causes pain. All of the joints of the lower extremity have a natural position where bones are most squarely aligned with one another and are most stable, where one bone comes squarely together through the joint with the next bone. All the joints, however, have some movement in them. Each of the 80 or more joints in the lower extremity have their own particular range of motion, which is normal for them. When the biomechanics get thrown off, an abnormal range of motion can begin to regularly occur. Either too much motion or not enough. This change from the normal will decrease function and increase pain. Gait, or walking, is the efficient continued forward motion of a person. When all the lower extremity segments are working correctly, muscles only have to contract during certain parts of gait in order to properly position the bones. The foot plays an especially important role in this play of many characters. First, it must bear the load, which during motion can be up to 4 times a person's weight. Second, it must be flexible in order to absorb the unevenness of the surface one is on and to absorb some shock when one first bears weight. Third, the foot must act as a rigid lever in propulsion to move the foot forward. Within the larger scope of lower extremity biomechanics, the foot is like a play occurring within a play. If one character forgets or mistimes their lines, the whole production is thrown off. People come to see me because they experience pain in their feet or elsewhere in the lower extremity. These problems generally occur for 2 reasons: overuse or overloading. Overuse is when the timing of a muscle is thrown off and it's asked to work for longer in the gait cycle, for a longer part of the gait cycle than normal. Inflammation and tissue damage can then occur, and pain and disability will follow. Overloading is when the position of a bone or a joint is not correct, and that bone or joint is asked to bear a greater share of its weight or bear it for a longer period than it was designed for. Again, inflammation and pain can then occur. These problems, or pathologies as we call them, are each unique and are the result of abnormal pressure or timing forces acting on the foot or the lower extremity. They're also determined by one's genetic makeup and life experience, such as work demands or athletic activities. They include, but are not limited to, bunions, hammer toes, flat feet, lower back pain, knee or hip pain, etc. Foot orthoses, or orthotics as they are commonly known, are devices designed to change the timing or weight bearing of various parts of the lower extremity. Some devices, like arch supports, don't realign the foot or change muscle patterns, but rather simply redistribute some of the weight-bearing locations. For some people, even this small change can help with reducing pain. For many others, a more substantial realignment of bones, joints, and tendons are necessary to effectively correct biomechanical problems that are at the heart of one's painful problems. To do this, a plaster impression is taken of each foot. This then produces what we call a biomechanically functional orthotic device, such as this. It has wedges underneath the heel and underneath the ball of the foot of the plastic shell to reposition and correctly align the foot. When placed inside of a supportive shoe, it helps the foot function more correctly and prevents pain. What a functional orthotic does is, instead of allowing the foot to flatten out and come down to the ground, by creating proper angles or wedges under the orthotic, we bring the ground up to the foot. That is at the heart of the realignment process. While, of course, this is just a brief summary of the field of lower extremity biomechanics and what functional angled orthoses can do, I hope you found it informative and interesting. Thanks for watching.